Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Overview of wheezing breaths. Wheezing is a high-pitched whistling sound when you breathe. It can occur with certain lung and medical conditions, such as asthma and chronic obstructive pulmonary disease, COPD. While common for some people, it can be a sign of a medical emergency. /r/n/r/n you can have wheezing without other symptoms, or it may occur alongside other symptoms, such as shortness of breath. A healthcare provider should diagnose the cause of your wheezing so you can get effective treatment. /r/n/r/n This article discusses how to identify wheezing and what causes it. It also covers how the causes of wheezing are diagnosed and treated. /r/n/r/n Wheezing can occur with inspiration, breathing in, and with expiration, breathing out, though expiratory wheezing is more common. Most people think of asthma when they hear wheezing, but other causes need to be considered, too. /r/n/r/n Wheezing usually comes from the bronchial tubes, small airways in the lungs. However, it can also happen with a blockage in the larger airways or conditions involving the vocal cords. /r/n/r/n Sometimes people have more than one condition which leads to wheezing. /r/n/r/n It's important to know whether the sounds you hear in your lungs are truly wheezing. That's because there are other sounds that can be mistaken for wheezing. /r/n/r/n During your physical examination, your healthcare professionals will listen to your lungs for sounds as you breathe. /r/n/r/n Your lungs may sound normal with a quiet sound of air flowing in and out, or you can have sounds that indicate a medical problem such as wheezing, crackles, or stridor. /r/n/r/n It's important to distinguish wheezing from stridor, another serious symptom that often has a different pitch and is caused by different conditions. Both sounds can be signs of life-threatening medical emergencies. /r/n/r/n Wheezing is often a medium-pitched sound that is loudest during expiration. It has a fairly continuous musical sound including more than one note. /r/n/r/n The sound of wheezing is created by a narrowing of the airways. This can be due to swelling or blockage anywhere from the throat down to the smallest airways. /r/n/r/n You can mistake stridor for wheezing. /r/n/r/n Some differences between the two. /r/n/r/n The most common causes of wheezing are asthma and COPD, but there are many potential causes including /r/n/r/n If you have been wheezing or have had a change in symptoms, it is important to see your healthcare professional even if you have experienced wheezing in the past or have been diagnosed with asthma. /r/n/r/n Call for emergency medical help if you are experiencing chest pains, lightheadedness, shortness of breath, have a bluish tint to your lips and skin, or swelling of your face, neck, or lips. /r/n/r/n The first thing your practitioner will do is to make sure you are comfortable and stable. In an emergency, medical personnel and technicians begin with ABC. This stands for airway, breathing, then circulation. It is important to assess these before going on to try to determine what is actually causing the wheezing. /r/n/r/n Once you are stable, your medical team will talk to you about your medical history and perform a physical exam. /r/n/r/n Some of the questions they may ask you include, /r/n/r/n Your physical examination will usually begin with measurements of your vital signs, oxygen level, and a lung and heart auscultation. /r/n/r/n Tests to evaluate your wheezing and determine a cause will vary depending upon your history and physical examination. /r/n/r/n Testing may include /r/n/r/n Depending on how serious your symptoms are, your healthcare provider will first do what is necessary to make you comfortable and control your symptoms. Since there are many possible causes of wheezing, further treatment will depend on the cause of your wheezing. /r/n/r/n. The first steps are to ensure you are getting adequate oxygen into your lungs. Oxygen therapy is commonly used. If wheezing is caused by an allergic reaction, injectable epinephrine is often given. /r/n/r/n. Other treatments will depend upon the underlying causes of wheezing. For example, treatments for asthma will be used to open the airways, whereas a procedure such as a bronchoscopy may be recommended if it's thought that a foreign body could be blocking the airways. /r/n/r/n. Wheezing is a high-pitched whistling sound when you breathe. It can be caused by different conditions involving the airways, including asthma and COPD. To diagnose the cause of your wheezing, your healthcare provider will listen to your breathing and may run tests, such as a chest X-ray, spirometry, or blood tests. Treatment will focus on opening the airways or treating any underlying conditions. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.